Go.
Good afternoon, class. Today our presentation will be about non-vascular interventional procedures. Your presenters for today will be none other than myself, Akia Bird,
and me, Tamika Robinson.
Percutaneous catheter drainage. This method of drainage of the intra-abdominal fluid collection has been proven an effective and safe form for therapy for collection. It varies widely in etiology and in site. There are 3 different phases for successful percutaneous puncture. The first will be access to the fluid collection. The second will be aspiration of the collection of the fluid to confirm the position. And the third will be the placement of the drainage catheter. At this time, we'll be talking about our drainage kit. We do have a presentation for our drainage kit. Tamika will be passing it around for you. I ask you to take the time to look at the different contents involved into the drainage kit, which is used for all of our percutaneous procedures. Just to give you an example of a few, we have our 5, 10, and 60 milliliter size syringes. We have our 22 gauge and our 25 gauge needles. We also have our universal drainage set and our fluid collection bag, as well as our vacuum extension set with the needle. That's just to name a few. The 2 most commonly used catheter drainage procedures. One would be our Schlesinger guide wire exchange technique. This is basically where a needle is punctured within the structure. A guide wire is threaded within the needle. Once the needle is removed, a catheter is threaded around the guide wire. Once the guide wire is removed, the catheter then is set in place. You also have your choker catheter assembly, which is just basically a fluid delivery cannula, which offers an interface between the access point of the patient and our working channel. Catheters are usually selected and governed by the volume of the fluid, the viscosity, the nature, and the margin of safety of the safety access route. Today, the percutaneous catheter drainage technique we'll be speaking on will be percutaneous catheter nephrostomy. It's better known as PCN. This procedure provides the temporary drainage of an obstructive urinary system. It relies on the placement of a catheter, and the choker cannula method is the most popularly one used. The purpose of having a PCN procedure. This percutaneous nephrostomy is an attractive treatment alternative because it allows the decompression of an obstructed system. It permits the specimen collection and creates a route for antibiotic installation if needed. This procedure decreases the risk of urosepsis associated with acute surgical intervention. Serious irreversible kidney damage can occur, and there can be a lot of stagnant urine can cause a lot of infection within the body. Just to give you an example of what the purpose will be, as you know, your kidneys are located in the posterior portion of your abdominal cavity. This is your urethra. Your urethra is a tube that allows the flow of urine from your kidneys to your bladder. Once this urethra gets blocked, which can be by either a tumor or a stone, at that time, urine is then backed up into the kidney, that which involves the swelling of your kidney. It could be either kidney, your right or left kidney. It really doesn't matter. Here's an example of where the stone would be. This is an example of the fluid backing up into the kidney. At that point, that is when PCN, which is percutaneous catheter nephrostomy, is needed. This is just a picture here that we're showing your normal kidney, an animated picture, showing your normal kidney. And this is how your kidney will look if it was filled with fluid. The tube placement. There are several ways that the kidneys can be localized. You have your ultrasound, which is the most common and the most used one because your fluid on the ultrasound shows up white. You also have your fluoroscopy, which is your non-ionic ionized contrast media, which is used. And you have your computer tomography, which is your CT.
The preparation. The preparation is a form of consent that must be signed either by a patient, next of kin, or a healthcare proxy. Laboratory studies such as a CBC, a creatinine, and a PTT, and if want anticoagulants, they suggest that you don't take your anticoagulants for a couple of days. Pertinent images such as a KUB, which we take. The patient must be NPO for 4 to 8 hours, and because they are under local anesthesia. This is procedures continue. And one thing that they like to do is the procedure is used with a 22 gauge spinal needle. It's a thin needle, and then after the needle is introduced through the skin, punctures the kidney, the trocar is then used, is then placed, and the urine is then used. There are two types of locking catheters. It's a pigtail, which locks the kidney in place, and the malachi. It locks the kidney in place at the distal end, which then makes a path for insertion. The indication, just to name a few, because there are many. It's the temporary urinary diversion associated with urinary obstruction and secondary catalysis. The treatment of non-dilated obstruction and uropathy, the treatment of urinary tract obstruction related to pregnancy, and also the treatment of complications related to renal transplants. And these are just extra indications. And the contraindications, in which it isn't many, is uncontrollable bleeding, uncooperative patients, and severe hyperkalemia, and which that just means that you have a lot of potassium in your blood, extra potassium, too much. And the complications. Well, the overall procedure is generally safe. About 98% of the patients avoid surgery. The 34% of complications, 6% is major and 28% is minor. There is a risk of allergic reaction to the anesthesia, bleeding and infection. Bruising from the catheter insertion site occurs in about half of them, which is minor. And the major complications include injury to the surrounding organs, bowel perforation, splenic injury, and liver, infection leading to septicemia, loss of significant kidney function, which is less than 1%, delayed bleeding or hemorrhage, which is less than 5%, and a blockage of the kidney artery, which is less than 5%. And to conclude, percutaneous catheter drainage is an overall safe treatment, and 80% of the major cases avoid surgery. PCN is one of the major types of percutaneous drainage procedures that is offered, and as the success rate continues to climb, the procedure will be used more frequently. Thank you.